Hello, fellow students and professor. The purpose of this presentation is to identify skin lesions by identifying whether they are benign or malignant. Skin cancers. Actinic keratosis can progress to a skin cancer, and most prevalent in light-skinned people. But exposure to the sun can cause this condition in any color skin. We focus on the head, neck, hand, and forearms. It's when it's untreated that it can progress to a squamous carcinoma. There are three main types of skin cancers. Basal cell carcinoma is the most common skin cancer. It is indicated by a pinkish skin or flesh-colored bump. Again, it is prevalent in light-skinned people, but it is not exclusive to dark-colored skin as well. The target area to watch for are the head, neck, hands, and arms, but can be found anywhere and is capable of penetrating organs and bones, etc. So it can be very invasive. There's also the squamous cell carcinoma, which is the second most common skin cancer. You look for red bumps that bleed or never heal. Again, most prevalent in light-skinned people, and exposure to the sun is what causes this, and any color skin is open to this condition. Once again, you're looking at the head, neck, hands, and arms, but can be found anywhere and is capable of penetrating organs, bones, etc., causing pain and exaggeration of body parts with the overgrowth of the cancer. And finally, we come to melanomas, and identifying them uses a process called ABCD, and that A stands for asymmetrical. So you basically take the lesion in an imaginary line in the middle of it, and if you have something that's asymmetrical where it doesn't look the same on both sides, that's your first indication. Then there's the border, where the borders are uneven, and the color, where you have various colors, either different tones of the same color or different colors in general. The next thing is the diameter. If it is greater than 6 millimeters, which is approximately the size of the end of a pencil eraser, then that's another concern. And you're watching these lesions to make sure that you're not seeing them either growing or changing in their characteristics. So detecting a carcinoma, it's a systematic approach. Basically, you're doing an examination of the patient, and you can either use a standing method where you look at their body from head to toe, or a lying down method, or a seated method. The main thing is that you examine everything, every area of the body from head to toe, between the toes, into the hair, look at the scalp. You want to verify that you're not missing anything. The next thing is that skin cancer is most prevalent in men on their backs. So if you have a male patient, you're going to want to focus on their backs to see if they have any of these lesions that we're talking about. Skin cancer is most prevalent for women on their legs. So if you are examining a female patient, then you want to pay closer attention to their legs. This does not exclude the other parts of their body, but this is where you're most likely to find problems, either men on their backs or women on their legs. Obtaining a sample for analysis techniques. There are 5 different processes for obtaining a sample. Cryotherapy, which uses a liquid nitrogen, which basically freezes the tissue and makes it possible to excise it from that area. There's the punch biopsy, where it is a hollowed out sharp tube that is pushed onto the area, and a cylindrical sample is obtained through this process. The scissor biopsy, that basically is using scissors to cut away that lesion. Shave biopsy, you're using a razor and you're making it convex so that you can shave the area and remove that sample. Then you have the excisional, which is important to note that it is an oval shape incision that's made with a number 10 scalpel. And the reason it's oval shape is so that when we suture, we're able to suture and have well approximation of the wound area. It's important to note that in all of these procedures, except for cryotherapy, that a mix of lidocaine and bicarbonate is used as a anesthetic, which creates a nerve block around the area, and you are to probe the area with the needle to verify that anesthetic has been effective. So this is a way that we avoid the pain that the patient would go through by removing these samples. The last thing is laboratory analysis. It's a potassium hydrogen mixture that is used to identify fungus species, and you're looking for possible fungi that has not responded to either cortisone treatment or other normal treatments to that skin area. The slide is then prepared and a high-power microscope is used to identify the species. Treatments, first-line treatments. Those include surgical excision, chemotherapy, radiation, or targeted therapeutics such as immunotherapy, or molecularly targeted pharmaceuticals. There are no practical second-line treatments because of the vast diversity of skin carcinomas. In conclusion, skin lesions are very important to identify. The methodology exists to expediently assess and diagnose and treat skin concerns. Exposure to sun is the most frequent cause of skin carcinoma, and lighter skin is more prone to this disease. The methods to obtain a sample for investigation are all known and to be accurate and provide early detection. It is critical that during the physical examination, the skin be observed with the intention to discover first signs of a carcinoma. I thank you for listening to this presentation, and I look forward to your comments about my presentation, and I look forward to also reading and seeing the presentations of my fellow students. Thank you.